Welcome to SCR Connection. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Katie Peery Musick. Katie is the director of the UTA Fab Lab at the University of Texas at Arlington Libraries. Katie provides leadership related to the development, management, and continuous improvement of the lab. She has published on diversifying makerspace student hiring and best practice for makerspace training to increase inclusivity, impact, efficacy of makerspace on a college campus. Katie grant work and research are primarily focused on integrating makerspace literacy into higher education curricula. In today's SCR Connection, Katie will share with us ways librarians can contribute to the pandemic response. Thank you, Katie, for being our speaker this morning, and I will turn everything over to you.
Thanks so much, Edward. I'm so happy to be with all of you today. I did want to also mention that my master's was in medical informatics. So while I am not a medical librarian, that has always been where my heart has been. So I deeply value the work that I do. And hope that this presentation will give you insight into how makerspaces can contribute meaningfully to the medical community and how librarians can serve as a bridge between gathering information, creating new information and new products that can help improve outcomes for patients and for doctors and nurses as well. So a little bit of background about UTA before I get too far into it. University of Texas at Arlington is located midway between Dallas and Fort Worth, which are two major cities within Central Texas, if you're not familiar with the area. So we are surrounded by wonderful hospitals and medical facilities, which we're very grateful for during times like these. UTA is an R1 research institution. We are the sixth most diverse undergraduate student body in the nation. We rank highly in services for our veterans. And the library, we have 3 branches across the campus. We are open under normal circumstances 24/7 throughout the academic year and provide virtual chat services as well. So it is deeply entrenched as part of our goals to make sure that we're meeting the needs of our UTA community and that we're connecting and serving meaningfully to the broader DFW community as well. The Fab Lab, which stands for Fabrication Laboratory, is a makerspace that's on the first floor of the main library on campus, Central Library. So on this slide, you can see a picture of our open study space. A makerspace, if you're not familiar, is an area that has a variety of creative fabrication technologies. So our staff is equipped to help students, faculty, and staff learn how to do both the digital design and the fabrication of their objects, whether they're using 3D printers or sewing machines. We have glass kilns, we have a shop room. And so we do see this as very tied to the primary goal of helping people find and create information. People are learning just by doing so hands-on instead of through your more traditional research avenues. So I would love to see if anybody wants to throw out in the chat. I'm very curious as far as our participants go, if any of you have worked in makerspaces or if you have a makerspace in your facility. If you already are familiar with how makerspaces are being used in the medical community, I'm going to add some additional ideas at the end of the presentation, but I'd love to see how familiar everybody is just with this concept of makerspaces and how it might actually apply to your specific field. A lot of the work that I've focused on, along with some of my colleagues, as Edward said, is integrating the makerspace throughout the curriculum on campus. So I think it's very natural to see how use of 3D printers or laser cutters or other tools might be applicable to students in architecture or engineering, where they are doing a lot of digital design and fabrication anyway. But a lot of my work has specifically focused on how we can apply these same tools meaningfully in other fields, such as English and history and nursing. And that way, when students are using the makerspace, it's not so much focused on the actual tool that they have access to, but a lot of those transferable skills, the creative thinking and the teamwork and collaboration that you can learn by making and by trying something new and failing and reiterating. So with all that being said, I don't think that makerspaces have incredibly advanced, fancy of equipment, expensive materials at their disposal in order to create meaningful impact. And that's a lot of what I've observed occurring in medical makerspaces. Sometimes they have a 3D printer or a laser cutter. A lot of times they have access to bandages and PVC pipes and different hinges and fasteners, things that are actually applicable and more easily adaptable within that specific field. And those are just as equally makerspaces as those with more advanced equipment. The core principle is the mindset of ideation and iteration, and knowing that you are empowered solutions to the problems that you're encountering while you're working. So one of the problems that we have all encountered over the last several months is the COVID-19 pandemic that has shut down portions of our community for the past several months. So when we first closed after spring break in March of this year, we immediately began seeing other makerspaces across the country and internationally discussing how they could contribute to the PPE shortage that many of our doctors and nurses were experiencing throughout the medical community. And I'll admit, I was very reticent about this idea when I first saw it. I was thinking, I don't know if we can contribute in a safe way to this. I don't know if this is helpful or if we could accidentally be causing harm by attempting to help and by attempting to make and distribute something that is not well vetted or something that has been tried and tested and approved by the medical community. Gratefully, the medical community and the makerspace community have come together and worked very quickly to create resources that are not necessarily approved, but that are assessed and cleared for clinical use. And so masks and face shields have been two of the primary pieces of PPE that makerspaces all across the country have been fabricating and bringing to hospitals and clinics in order to help bridge that supply chain that we experienced. I think some of those supply chains have been restored now, but certainly back in March, April, May, doctors were not able to function with the same level of safety and the same PPE that they were accustomed to using. So what I thought I would share about today is a little bit about how we arrived at the decision that we would start making PPE, given some of the concerns that I and the rest of my team had around this, some of the steps that we enacted in order to create the PPE safely, how we distributed it, and then other resources and implications for the rest of you as medical librarians who might have access to a makerspace or similar tools, so that you can see how you could adopt similar practices within your work environment. So as I mentioned, I was a little reticent about making PPE when the idea for this first came out. I wanted to make sure that we were making something that would be sanitary and safe for use and not give the illusion of safety without actually providing the needed protection. So at the end of March or early April, there was a webinar that was hosted by America Makes, and they have partnered with the NIH 3D Print Exchange, the FDA, and the VA to vet submitted designs for PPE. So I do want to be clear, they are not officially approving or endorsing any of the designs. but they do go through a rigorous vetting process, and they will then rank the different designs and kind of label them as far as whether they believe that they're safe to be used for clinical use, for community use, or if they don't believe that that the design is actually safe to be used at all. So once I had attended that webinar and kind of had seen that vetting process and knew that the FDA and the VA were involved, at that point in time, the FDA was also providing emergency use authorization for a lot of these designs. So while I said that all of the designs are not approved for clinical use, a few of them were when we were in a clear shortage of PPE. They are called emergency use authorizations, or EAUs, EUAs. So that gave me a lot more confidence that this was not just a design that another maker across the country had come up with and put online, and we should all just start making it. There are clear guidelines about what settings the different designs should be used within, what materials you should use, what settings you should be making within, different safety precautions that you should take as you're making to make sure that you're not contaminating the products that you're creating. So if you are not already aware, the NIH has a 3D print exchange, which is just an open repository of hundreds of different 3D models. Historically, I've used this to refer to different models of medical conditions. I've known children's hospitals that have downloaded and printed different models so they can help explain to the children or to the parents exactly what is going on with their child, so that they can better visualize the problem that they're encountering. They have designs for ID warmers, IV, different ways that you can laser cut bandages so that they're better adaptable and movable around different IVs and things like that. So there are a wide variety of designs that are available openly on this site for anybody who wants to take advantage of that. And that is where they have a special page right now specifically for COVID-19 designs. So that when a user submits their design, it then is vetted, as I was saying, by the VA, and it will receive one of the following designations that you see here at the bottom. So you know immediately whether a design has just been submitted. It is marked as being in prototype mode. If it has been cleared for community use, that means that it is for the broader community. These would be things like face masks, but they're not approved to be used in a hospital or clinical setting. Then you have the next tier up, which is clinical use, and then the warning label, which would indicate to you that this is a design that has been submitted, it has been reviewed, and it is not recommended that it be used for further use, or you should use it create it and use it with discretion. I'll quickly bring up, let me go to share the web page for the NIH 3D Print Exchange, just to help y'all visualize how this is all set up. So when you search for NIH 3D Print Exchange, it'll bring you to the main page here. Up in the upper right-hand corner, you'll see the COVID-19 Supply Chain Response Special Collection. And so when you click on that, it does have this guide, the Start Here guide, which gives you clear information about how the different organizations that are sponsoring this site are working together, and what exactly it is they are approving or recommending as far as creating these items. And as you scroll down, you can see some of the different designs. This first category are some of the designs for clinical use. So ear savers have been a big design. This is one that you can see here. If you have tried to put on a mask and have trouble with the elastic digging into your ear or slipping off the ear, There's numerous different designs. You can see another one here for just a 3D printed piece of plastic with different notches for you to strap the elastic ear band around, so that it's putting less pressure on the back of your ear and not slipping off, which is incredibly uncomfortable, especially if you're wearing a mask for hours and hours at a time. We first started creating shields. There were just a handful of models on this site. Since COVID-19 was new, people previously hadn't been designing for this type of thing. So I will go next into the specific shield that we used and how we went about creating it. This is the one here, the IC3D Budman face shield, third over on the bottom, that we have been making. But as you can tell, there are numerous more designs. You can also click search the collection. This is just a preview of everything that's been approved for clinical use. And then there are also the additional designs for community use, things like hands-free devices. This is like a door opener, so that you don't have to touch handles. So all kinds of products that you can create to help help your clinicians and help the community feel a little bit safer and more protected. And as Edward said, if y'all have questions at any point, I'm keeping a quick eye over on the chat window. I know we'll have question time at the end, but I'll try to address any questions I see come through as we're going as well. So the shield that we ended up selecting, as I mentioned, is the IC3D Budman face shield. This was one of only a handful of shields, as I mentioned, that it was actually approved for clinical use when we started creating these at the end of March. And it's a fairly simple design. It's minimal parts. There are other designs that involve even fewer materials than this one. But we had all of the pieces of equipment needed to create this. And we thought that of the different designs available, this was probably one of the most comfortable for clinicians to wear if they were needing to wear them for long periods of time. So it's essentially made from just 4 parts. The gray band that you see around this person's head is a 3D printed visor. That's really the only part of this design that requires some sort of digital fabrication CNC equipment. So we are able to print that using ABS plastic. The guide that comes with when you, on the excuse me, on the NIH website does tell you specifically which types of plastic are okay to use. It'll also tell you which types of printers are suitable to be used for different designs. So that's something to keep a close eye on. There are a variety of different print abilities out there. Not all printers create items in the same way. I'm seeing that this is a blank page. So let me try to troubleshoot that. Edward, is there a way that you could take back control and then resync the presentation?
Yes, do that.
I'm seeing it, so I'm not sure why everyone else is not seeing it. So apologize about that. But as Edward is pulling that back up, just a word of caution when you're looking through designs, make sure that it is a design that is appropriate for the type of printer that you have and that it's appropriate for the type of plastic that you're wanting to use. They're not all created equal. They have different breaking points, different types of printers might FDM printers, that's what we have. They create a 3D print by building up a layer of plastic layer by layer by layer, which also creates small microscopic gaps between the layers. So that's fine in a lot of cases. In other cases, especially in a medical setting, that those little pockets could be areas where bacteria could grow. It's not considered food safe. So you do need to be cautious about what type of printer and what type of material you're using before you get started. But that is the only piece of this design that is 3D printed, the only piece of the design that requires any sort of fabrication technology. In addition to that, there is an acetate shield that is going across the front of the gentleman's face here. We laser cut sheets of acetate, and the acetate we were just able to find and order online through Amazon. The same material that you would use for a transparency, if you use those in school back in the day, transparency sheets for the overhead projector. Amazon sells large rolls of those that we were able to cut down into smaller sheets and laser cut out, which made production incredibly fast. However, you can cut hand. It's not a thick material. And the way that this design is created, you can actually hole punch the holes in order to get the visor to attach to the acetate sheet. So you can kind of see the three little notches across the forehead band of the 3D printed visor. Those are spaced so that they're the same spacing as your standard hole punch. So you could just punch it if you needed to. What you can't see in this image is a strip of foam for forehead padding. This could be weather stripping. Again, the guide gives different parameters for what type of foam that you can use. And then there's an elastic strap that loops through to actually attach it to your head. So just those four pieces, a laser cut visor, a 3D printed visor, laser cut acetate sheet, the foam forehead padding, and the elastic strap. So the most time consuming part of this production is just the wait time for 3D printing all of the visors. Laser cutting goes fairly quickly, though there was a little bit of prep to cut the sheets down. To watch the laser cutter while it's running to make sure that it's cutting well and we're not creating a fire hazard. But the other parts of the process, such as cutting down the elastic foam, cutting down the elastic straps, that can be done while the visors are printing or while the acetate is being cut, so long as you're keeping an eye on the machines. We had probably 5 to 6 different student employees that were helping us to create these shields. We did have full-time staff that were overseeing the project and that were assisting, but in large part, our department is staffed by our student employees every semester. So when we closed due to COVID, they did not have much work that they could do, and many of them were eager to be making and to get back into the space. So this was the quantity that we were able to produce was only possible because we had our student employees who were helping us to work in this space. And I'll go into how we set that process up here in a moment. So in this image, you can see a corner of our Fab Lab. And this is one of our student employees, Esau, who is assembling the kits of shields that we were going to distribute. We were very cautious right from the get-go to make sure that we were creating as sanitized of a work environment as possible. We can't guarantee sterilization. We're not a clinical lab, and there are different designs that require that level of sterilization. This particular design did not, but we still were striving to, of course, to be as clean and as safe as possible. So one of the first things that we did was rearrange the space. You can see that there's actually 2 different types of tables in our setup right now. We've got butcher block wood tables over on the right-hand side of the image, and then glass tabletops in in the middle. So anything considered dirty or unsanitized was put on the wood tables. Anytime a new shipping box came in, it went over there. The papers with the instructions are all on the wood table. They are cleaned as well as we can get them as well, but wood is a much more porous surface and much more difficult to clean than glass. So we kept the actual assembly of the shields on the glass tabletops. You can see that Esau is wearing a face mask and a face shield himself. He's also wearing gloves. So we had a strict regimen of when you're entering the space, you need to go and immediately wash your hands, put on your face mask, put on the shield, wash your hands again, put on your gloves, and anytime that you might accidentally touch your face, anytime that you're touching anything that's on the wood tables or that's not sanitized, you need to change out your gloves, wash your hands again, and put on a new pair of gloves. So on the back table, you can kind of see stacked up some stacks of the visors. But what we also made sure to do is, as we were assembling the bags of the shields, we didn't actually attach the clear visor to the 3D printed headpiece. Just for transportation purposes, we didn't want that shield to get bent in transit and create any sort of visual impairment when you're trying to look through a bent piece of plastic. So we just left that plastic sheet flat and put it in a Ziploc bag with the headpiece fully assembled without the shield. So there was the visor with the foam, with the elastic on the back, that went in the bag, and then the plastic shield was just slid in with it. And all you have to do is pop that shield onto the visor as soon as you've gotten it out of the bag. But we did also ask everybody to initial and date the bags as soon as they were assembled, just in case there was any sort of issue where somebody got sick, whether it was COVID or whether it was just a cold and we weren't sure. We wanted to be able to weed out any of the shields that they had produced so that we were not transporting those. It also gave the clinicians the date that they were bagged so that if they wanted to wait a certain duration of time to make sure that any sort of germs that might be on the shield were potentially or likely dead before they're using it, they knew the last time they had been touched by anybody else. I see a question. What is the cost to print each visor and strap lock, and what type of filament is used? So we, in our lab, we used ABS. I believe you can use PLA or some other types of plastic as well. This particular design wasn't limited to just one type of plastic. The shields themselves, I should have gotten an exact cost on the breakdown of what each shield was, and I didn't do that in advance, but it was probably only a couple of dollars per shield. We charge 5 cents a gram for the ABS, and the shield itself is very lightweight. That's actually a little bit higher than what the actual cost of ABS is per gram. So probably only 25 cents, if that, for the actual 3D printed shield and the strap lock in the back. And because we were planning on making so many, a lot of the other supplies we were buying in bulk quantities, which allowed us to pay less per inch of elastic and inch of foam as well. I can look further into that and get an exact cost and share that out with everybody. I will say too, initially it was difficult. We had started on this venture and then realized there were shortages, not just on PPE, but on elastic. And because so many makers across the country were making shields, we then struggled to get some of the acetate. So thankfully, makerspaces have a good communal network, and we were able to talk to some other makerspaces in our local community and find resources where elastic was being produced commercially, and we weren't just looking at Joann's or Amazon or what we prefer to do is find local vendors, but that wasn't possible right when we got started. We were able to find commercial manufacturers that we could buy in bulk from during those shortages. That's a great question. So in total, over the last few months, I'll say since the start of April, because it did take us a few months just to figure out which design or a few weeks just to figure out which design we actually wanted to go with, all of the safety precautions that we felt okay with moving forward with, and then actually getting all of the materials in. So between April and the end of July, we have created 700 shields. About 50 of those we have saved for library staff. We just reopened our library on Monday, and so some of our staff who are working at the public service points wanted a shield to feel safe interacting in those spaces. So we did make some internally, but the other 650 have all been distributed to local area hospitals and clinics. Initially, my primary goal was to find hospitals that needed shields, and John Peter Smith Hospital in Fort Worth, known as JPS, was one of the hot spots that was giving primary care to COVID-19 patients. So we gave the first batch of 150 directly to them. By that point, I think after that initial drop off, a lot of the hospitals were able to procure face shields again. They also have more resources than some of the area clinics. So that was our next phase. After we'd called several hospitals and realized that they were pretty well taken care of, we specifically focused on clinics and testing sites. And they were incredibly grateful. They definitely did not have necessarily the financial means to pay the premium since some of the prices for PPE have jumped. And they were just struggling to actually find anybody who had shields available. So one of the clinics that we donated to is also located in Fort Worth, Texas, but they do not charge their patients. It's specifically designed to serve low-income families in the area who do not necessarily have insurance and don't have other means for medical care. So they're a nonprofit and did not necessarily have the means to find and purchase their own PPE. So we gave a couple hundred there. There were a few other testing sites throughout Arlington that only needed 20 or so each. And then we did also partner with the city of Arlington, which was great when we discovered them, that they were already liaising to different community services within Arlington, such as the homeless shelters, and making sure that the people who were volunteering and working in those settings also had the needed protection. So we did kind of move beyond just the hospital setting, but continued to focus on agencies that were helping people in need, people who potentially had COVID and needed protection from that. So this is me with one of our community partners in Arlington, and she has been a wonderful partner in finding those other agencies within Arlington who continue to need PPE. So we have primarily focused on creating face shields since we had the equipment and the students who knew how to 3D print, and we had the means to do that. I recognize that a lot of makerspaces do not have those technologies or do not have staff or volunteers who necessarily know how to operate those types of equipment. but there are other resources that you can be creating as well. So the other half of our efforts have been focused on making masks. And these we weren't distributing to hospitals, but we were making them available to the UTA community. As I mentioned at the beginning of the presentation, UTA is the sixth most diverse university in the nation. We have a lot of low income and first generation students on our campus. We have a lot of international students on our campus. But regardless of those demographics, there are plenty of students who were in need of masks who didn't necessarily have the means to purchase one. We actually began making these before it was common practice or the recommendation or requirement to wear masks. Now that is the current state, other departments across campus are purchasing and providing masks as well. But we were kind of the front runners in providing those to our campus community. So we have several sewing machines in our lab. Many of our student employees had sewing machines at home too. We have one of our students actually created she created this specific pattern using a hodgepodge of different designs that she had seen online. We kind of discussed what we felt and what we had read about to be the best recommended settings. So there is a little filter pocket on the inside. You can kind of see at the top of the picture. These are the same type of mask, but the top is an inside view of the mask and the bottom stack is the outside view of the mask. So we made sure to use different colored, a different pattern or a different color of fabric for the front and the back, just to make sure no one was accidentally putting it on inside out. We were also always recommending that you wash the masks in between uses, but just knowing that sometimes people might not be doing that, we wanted to make it really clear that they didn't put the outside of the mask right up against their face if they didn't wash it between uses or if they had to take it off and put it back on. So we did use our laser cutters again to cut out the fabric itself just to make it a little faster. You, of course, don't have to do that. You can trace a pattern and cut it out, but that definitely cut down on production time. We've also included a wire nose piece at the top. We actually just used pipe cleaner, which had a little bit of padding, but also still had the wire in there. It was something that there was actually a shortage of pipe cleaners as well, but we were able to find some from Walmart and then some from Amazon throughout the making process. And we figured, like, who cares if it's an ugly color pipe cleaner? It's going to be inside the mask anyway. And then we have elastic or hair ties for strapping the mask behind the ears. We found that the elastic was a little bit difficult to sew through, which is when we went to just using a hair tie, which is already in a loop. So you just had to fold the fabric around that hair tie and then sew it closed. Now we've seen other designs that for adjustable ear straps, which are great, and I would recommend if you're just starting to go that route. But when we were first figuring things out and trying to make things incredibly quickly, we just went with the hair ties. So far, we've made about 530 of the masks as well. In addition to our Fab Lab staff, we also had other library staff who love sewing. We actually have a crafty circle that meets when we're meeting in person. They meet every couple of weeks within the library. So many of our staff had the sewing skills. We were able to just create kits of with the laser cut fabric and the pipe cleaner and the hair ties so that they could make them at home if they were working from home, and then they would just bring them back into the library. We did run them through a washing machine and wash them before we put them at the desk for distribution, and then we also encouraged everybody to wash them themselves before actually wearing them. So these continue to be very popular. Like I said, we do have some masks that are provided from the campus as well now. But it's fun to give the students an option and say, like, do you want ask, we're like, this one was made with love from the Fab Lab. And a lot of times they're choosing one of the patterned ones that that we've made. And I should mention too, we did purchase some of the fabric. A lot of it was donated. We already had a large fabric that different users have just given us over the years. It's just scrap in. Sometimes we have people who are cleaning out their craft closets and they don't need it. So we've always had that available to our students if they're needing to do a sewing project or if they're wanting to learn how to sew and practice and don't want or have the means to purchase their own material. They can just use the scraps that were freely provided to us. So we used a good bit of that to make these, but we did do one run to a craft store to get more fabric to make some more. So other implications and resources for all of you as medical librarians and people within the medical community. I'm sure we've got a variety of users on here. Do I still have an echo? I just looked over at the chat. Oh, it looks like it's gone away now. Okay, apologies for that. Not sure what happened. So if you, whether or not you have a makerspace in your community already, there are resources to get you training and to help provide insight as to what materials or pieces of equipment you might want to include within your makerspace, whether you're expanding it or thinking about creating one. UTMB, which is the University of Texas Medical Branch, was actually, I don't know if anybody from there is on here, so hello if you are, but they were the first hospital makerspace that opened several years ago, and they actually have a program called Maker Health, which provides training and access to resources to specifically train those who are within the medical community on how to create makerspaces and how they might use them within their practice. Maker Nurse is another organization that falls under the umbrella of Maker Health, and they provide similar resources, I think more specifically for nurses, but just looking at some of their social media, they've got great ideas that they've been sharing through their conferences about how you can use makerspaces in your practice. So like I said earlier, I've seen laser cut custom bandages, different clips and connectors to organize tubes and cords and IVs, especially if somebody is connected to a lot of different machinery and needing a lot of medication, just devising their own way to organize all of those wires, both for the comfort of the patient and for ease of access for the healthcare providers. There are simulation models if a clinician is needing to practice a specific procedure. Sometimes they've taken an MRI or a different scan of their specific patient, printed a model of the specific area that they would be operating within, and practice doing the procedure using the model instead of just looking at scans and trying to think through how they might adapt their standard practice for this specific case. I've also seen gurney shower systems, prescription bottles for visually impaired, 3D printing braille that there's different types of plastic ones called Ninja Flex, which is like a flexible rubbery material. So something that you could just strap onto a bottle or even somehow punch through like a label maker material so that they can feel and read the specific names and labels that are on those bottles. So there's lots of ideas out there. If you're looking for other ideas specifically related to how makerspaces in medical communities can contribute to COVID-19, St. Luke's Hospital Makerspace in Iowa, I've linked a specific article there, but they've created about 20 plus COVID-19 solutions, at least at the time of the writing of that article. And many of them are sketched to bedside in under 4 hours. So that's something that I found encouraging too. Oftentimes when we think of prototyping, it's weeks or months of devising the concept and then creating the model and then iterating on that. But they're thinking of very fast, easily implementable solutions. So for example, they wanted to ensure that whatever medical supplies were designated for a specific room were only being used within that room. Rather than using sticky labels to put on some of the equipment, they were laser etching into stethoscopes and other things the room number so that it was very clear what needed to stay there. So it doesn't necessarily have to be a medical invention. It can also just be very practical logistical things that keep the practice organized. And then there are a variety of other resources as well. I didn't list all of them, but Enabling the Future is an organization that specifically focuses on creating 3D prosthetic hands. So that's another project that we have worked on in the past with a professor whose son was born without his forearm. You can take scans of the patient, measurements of the patient, and create a workable hand using just 3D printing materials and a few other additional materials as well. So I encourage you to explore those options to get ideas about what you might be able to do in your own practice. This image here is actually a 3D printed model of the COVID-2 virus that was used by Dr. Fauci in different communications that he's done over the last several months to help illustrate what this virus is, what it looks like, how it works. This was created using some cells from one of the very first patients in the United States. And it was also found on the NIH 3D Print Exchange. So that is a wealth of resources that you can explore there. But everything from medical models to practical uses, like I was saying, with laser cutting into a stethoscope. I've also seen things like using PVC pipe and some clear painter's plastic just stretched across the PVC frame and kind of clipped with 3D printed clips to kind of shield a patient. There's just a little window cut into it so they can access the patient, but so that they're quickly able to pop something out if they're in an ambulance and encountering a COVID patient to give some sort of barrier between the caregivers and the patient themselves. So all kinds of resources for you, and I hope that that's inspiring. I do have a list of references here for the different resources that I've mentioned throughout the presentation. And I know we've just got a few minutes left. So with that, I will open it up to questions. Thank you to Linda, who said that they're the best looking masks she's ever seen. I attribute that to the beautiful fabric that was donated to us and our student who helped design them, but thank you very much. Oh, let me scroll back to the references slide. Sure.
Do we have any questions for Katie?
Oh, I do see one from Steph. Did you charge the nonprofits for the shields? No, we actually didn't. And that was something I discussed with our dean before we got started. Just what our budget should be, if we would be asking for anything back from the shields. We were in a unique situation in that we typically have budget money set aside for different outreach events that we do both for our UTA campus community. And sometimes we're going out to other schools or public libraries, and we're covering the cost of materials so that people can participate and get engaged with the library and then be exposed to all the other resources that we have to offer. So since we were not doing any of that programming that we normally did for the remainder of our fiscal year, we were able to use some of those funds towards the materials and not charge the nonprofits that we were giving the shields to. Our student employees operating the printers, what are their backgrounds? That's a great question, Brian. Yes, our student employees are trained on how to use the 3D printers and the laser cutters, the sewing machines. When we hire them, we actually do about a semester's worth of training with them. We try to hire at the beginning of a summer semester when we just have a little bit less traffic, but we do pretty rigorous training on every tool that we have in the space so that they're fully equipped to help train other students and staff that might be coming in to use the makerspace. So and I will say the students that we elected to bring in to help us with this project were some of our more experienced students or the ones that we have classified as our student leads. So we have student leads and student assistants, and the leads help to supervise the assistants. So there was they're already accustomed to a greater degree of responsibility and a greater degree of trust, to where like we're still in the building observing them working, but they're able to work fairly autonomously. As far as their backgrounds, we hire from all across campus, and we actually do that very intentionally because our makerspace is open to all majors. We want to make sure that all majors feel like this is a place for them. And we realized early on we had primarily engineering students staffing the space, and they were incredibly skilled and personable and helpful. But we did find that people from other majors, particularly from the humanities, felt like, like they're really nice, but I feel dumb asking them questions. And it's been an encouragement to our community to have people from other majors in the space, and to have people working in the space who did not know how to use the tools before we hired them. So we actually try to find people from the humanities who have not used a 3D printer before but are incredibly excited about it and show a high technical aptitude, and we train them to use all of the tools. So the students who were actually working on the SHIELD project, the two primary ones, one is an engineering major. The second was actually a PhD history student who's worked with us for several years. So no required background in manufacturing or engineering or architecture required. And that's one of the great things about the NIH 3D Print Exchange. You can see other people who have printed the specific models that you're looking at. Sometimes there are comments and notes. Some of them have been reviewed so that you can see how easily printable they are. So if you're not accustomed to modeling or editing modeling, not all of the designs would require that. Some of them are a little more plug and play. So if you know how to get the printer started, you're not necessarily having to do a lot on the modeling side. I will say for this particular shield, one of our staff members did work with some of our student employees to slightly modify the shield just to make it a little more comfortable, minimize some of the gaps or any stringiness that we might be experiencing while we were printing it. So it worked fine. It worked well as it was if you just downloaded it. But because we have the skills to be able to edit it, we did optimize it as much as we were able to. So we've actually even for the ones we made for staff, they even added our Fab Lab logo so we can have some branding as people are wearing them throughout the space.
Thank you, Katie. I think that's all the time we have for questions. I would just like to say thank you for that wonderful presentation. It was a pleasure to have you with us this morning.
Thank you so much. It was a pleasure to be here, and I hope that it was helpful to all of you.